Hello, everyone. My name is Rose Michele. I'm going to be addressing adolescence vaping. If I can get so adolescent vaping, which I'm sure we all know what vaping is, but vaping is a smoking device that is used to deliver nicotine, sometimes flavoring, and other chemicals via inhaling aerosol, and are marketed as an alternative to traditional cigarettes use. Originally, I believe they were used to like as a quitting mechanism, but they have not all been positive. What is considered adolescent vaping? So, adolescent vaping would be referring to typically ages about 12 to 18 years of age. So, my goal is to analyze adolescent vaping through the lens of the economic ecological model and the theory, using the theory of planned behavior to understand and address factors that drive this epidemic and how we can improve it. So, background from the CDC. Adolescent vaping has increased dramatically over the last decade. When it was studied in 2011, less than 2% of high school students reported using e-cigarettes, where in 2024 it rose to 14%. So vaping poses a significant health risk, especially for developing brains, bodies, and it can also cause nicotine addiction early on and increase the likelihood of future substance use. Sorry. Why vaping? So, vaping among high school students, like I had mentioned, has risen up to 14%, but that's actually a 600% rise from the 2011 survey. So that is highly surpassing the rise in obesity, mental health, substance abuse. So it is raising at a much higher and rapid rate. So the ecological model for adolescent vaping would be if you're looking at from an individual level, the risk perception and the vulnerability to addiction and coping skills all impact the vaping uptake. Many adolescents underestimate risks. So think of back when you were a kid and you were invincible. Wasn't going to happen to you, no worries in the world. So the interpersonal side is the peer pressure, seeing others doing it. You know, my friends are doing it, my family's doing it, my parents, my older siblings, and whatnot. It's putting that more pressure on these kids to think it's the cool, acceptable thing to do. Now, from a community level, if they have a supportive school climate and clear anti-vaping policies, they generally are at a lower risk and the rates aren't as high in those areas. So the community attitude and the availability of the vaping products locally hold different risks. If you're in an area that is more likely to sell maybe to minors or they have easier access to it, they're more likely to try it. Societal, there's the policies, the media, the economic, the cultural norms, all those things have an impact on why these kids are making these decisions. So now, if you look at it from the theory of planned behavior, the theory of planned behavior is driven by intention. So it uses three key factors: attitudes towards the behavior, the subjective norms, and the perceived behavior control. So the attitude of these adolescents or the beliefs about vaping does directly affects the likelihood of engaging. Studies show that positive attitude towards vaping, like many things often shaped by misinformation or marketing, precede higher use. If you think it's something cool because you keep seeing it everywhere, you're more than likely going to try it. Subjective norms or peer parental influencers are powerful determinants. If everyone's doing it, why shouldn't I? If my social medias keep seeing it, if my influencers are doing it, I'm more am more apt to believe that it is a norm and that it's socially acceptable. The perceived behavior control is refers to the adolescent's confidence in their actual ability to this refuse vaping, to just have that self-confidence to do so. The easy access to produce to the easy access to the products, the low confidence, and resisting that peer pressure can also lead to higher use. So if they have the strong refusal skills in a supportive environment in which they can feel they can say no to these things, the likelihood of vaping is lower. So the theory of planned behavior suggests that intervention should target these three domains. So, for example, like programs can correct misconceptions to shift these attitudes, using peer-led campaigns to reshape these norms, to teach refusal skills rather than giving into the peer pressure can help. Evidence supports that the use of the theory of planned behavior interventions reduce substance use among youth. So, this framework for understanding why adolescents vape and designing some good interventions that address these attitudes, norms, and behavioral controls could help the enhance the effectiveness of preventing adolescent vaping. So, like some of this says, so what should change or what needs to change is policies, stricter regulation against e-cigarette marketing across all platforms, um, so that kids don't have as much adolescents, I should be saying, I apologize, don't have so much viewing of these marketing on their social media apps, on their internet searches, everywhere. State and federal government should close the loops on online sales. Right now, it's really entering your information, but who's to say your information is correct? And to ensure reinforcement across the local communities, making sure that these locations aren't selling to minors, having stricter rules. So again, education, having comprehensive evidence-based curriculum should be in the middle schools and high schools, focusing on the dangers of nicotine addiction and correcting like these misconceptions that it's not that big of a deal, and building refusal skills so that they don't give in to these peer pressures because they don't want to be the kid that's not doing it. System. So the systematic and community level interventions would be, again, school, community organizations. They should adopt these preventative programs, establish them like clear anti-vaping policies, and also provide support to students who actually want to quit. Overhaul of public health messaging and surveillance, again, public health campaigns, and utilizing like digital platforms for like getting out that correcting that misinformation and real-time surveillance of keep track of products and usage patterns could help reduce that rapid increase. So, in conclusion, adolescent vaping represents a rapidly escalating public health crisis with serious consequences for youth. Addressing this issue requires a very comprehensive, multi-level strategy informed by, informed by both the ecological model and the behavioral theory. Through coordinating efforts among policymakers, educators, families, communities, everyone really, we can reduce vaping rates and safeguard the health and future of our next generation. I hope that you enjoyed this, and I hope you guys enjoyed the class. And thank you for listening. Bye.